Hello friends, welcome back to Unacademy. Let's crack it. So, this is the YouTube section where we are going to take target AIIMS 25 best MCQs in pediatrics. Basically, I have made a set of 50 best MCQs for all of you. So, today in this 25 minutes, I am going to share the first 25 best MCQs. Then, what I want to do is that you then revise more in pediatrics, and then I'll get back to you shortly, say by next Tuesday, with the next 25 set of pediatric MCQs. So these are like the single best answer questions type. Okay, and so once you start solving them, you will really understand that what are the quality of MCQs that are expected in AIIMS. Okay, this is only a trailer, as I told you. Only 25 will be taken, but we have similar such discussions on the Plus platform. So it will be always better that on that platform we have one-to-one discussion as well. So let's begin up. I hope all of you are in good health and spirit, especially with the coronavirus round in the air. Let's get buckled up and let's start solving the MCQs. So this is more like a self-assessment as well as a practice session for all of you. Okay. So the first MCQ, aortic stenosis. True about aortic stenosis, that it is the commonest cardiac lesion in Down syndrome. Right ventricular hypertrophy is common, and ejection click suggests the stenosis is supravalvular and there's an association with sudden death. Can you tell me what the answer could be in this? Any of the live members, you want to answer this particular question? Okay, so I got one answer over here. Rest others, I can see that 3 of you have joined. Well, okay. Dr. Dilpreet, over here, I would like to tell you one thing, that aortic stenosis constitutes about only 5% of the cardiac lesions as far as Down syndrome is concerned. Right ventricular hypertrophy, of course, is not expected because it's an aortic stenosis. So, and secondly, this ejection click. When we are talking about ejection clicks will always suggest valvular. ठीक है, valvular stenosis. Please remember that ejection click is typical for valvular stenosis. In fact, severe forms of aortic stenosis often land up with episodes of syncope or sudden death. ठीक है, is that clear? Okay, now let's solve the next MCQ. Williams syndrome. The commonest cardiac lesion is an atrioseptal defect. It is caused by macrodeletion on chromosome 7. It is associated with normal developmental milestone, and hypercalcemia is required to make the diagnosis. Can you tell me what is the correct statement over here related to Williams syndrome? See, even if you're wrong, it's absolutely okay. At least I'll understand that what I need to explain to you so that you understand the topic. So just try attempting this question. Okay. Anybody else wants to give me some other answer? Williams syndrome? So I'm getting a mixed answer over here, but most of you have answered A. Actually, the commonest cardiac lesion in Williams syndrome is supravalvular aortic stenosis. Okay, that is the commonest cardiac lesion. In fact, I've taken a complete details of Williams syndrome in one of my chapters in genetics, and there I've stated that it is because of the microdeletion on chromosome 7. Okay, so B is the correct answer. Anybody who has marked B? So Williams syndrome is nothing but a microdeletion on chromosome 7. It is associated with normal developmental milestone. Actually, no. They often have developmental delay, and they often have abnormal facies, which is often called as Elfine facies. ठीक है. They have this long nose, long philtrum, white mouth, thick lips, and they are developmentally delayed. Hypercalcemia is required to make the diagnosis. They have this idiopathic hypercalcemia, and which often goes away by 2 years of age. But hypercalcemia is not required to make the diagnosis. The diagnosis can be made by fluorescent in situ hybridization. ठीक है. Is that clear? So I think I've made my points very clear. So finally I got one correct answer over here. The name of that person is very interesting, Matt for AIIMS. Okay, so the answer is B. It is caused by macrodeletion on chromosome 7. Very good. ठीक है. Oops. Now solve this. Causes of right to left shunt in a neonatal period include. Now this is a very good applied kind of a question. Critical aortic stenosis, Epstein's malformation, methemoglobinemia, large VSD. So what are the right to left lesions over here? Yes, I'm waiting for the answer. Very good. Yes, very good. So I got two answers, very quick answers. Excellent. The answer is B, Epstein's malformation. Okay. Okay. Now solve this. Yes, VSD is left to right shunt. Very good. And methemoglobinemia has nothing to do with shunt. Okay, now solve this question. A 1-month-old baby presents with breathlessness and poor feeding. Her mother says that she has been getting worse over last week. On examination, she is found to have a large liver. RR is 60 per minute and an active precordium with a soft murmur. SpO2 is 94% and she has good femoral pulses. What would you advise as most appropriate treatment? Start digoxin and follow up in 3 months. Start captopril and follow up in 1 month. Refer to immediate cardiac surgery and start diuretics and admit to ward for observation. So very simple question. But yes, the applied clinical skill. This is nothing but applied clinical skill. So you definitely get such kind of questions in the exams. Very good. So I've already started getting correct answer. So one, yes, no. Matt for AIIMS has given a correct answer. Others are coming up with mixed answers. Okay. See, a 1-month-old child can present. So, what is the commonest lesion that you would expect in this age is a VSD. Now, VSD can be a small VSD as well as a large VSD, correct? But whatever it is, they all manifest later. Like they will become symptomatic later, right? The VSDs, ASDs, PDA, they will always become symptomatic later. VSD is known to land up with CHF after 1 week of life, correct? Now, if it's a large VSD, then they will have pulmonary hypertension as well. But here what they are saying is they are showing all the signs of CCF, correct? The first and foremost, but you are not sure what exactly is happening to this patient because this is quite like late, 1 month old, quite late for a 1 month old to present with a last VSD in this manner. Okay, so preferably the answer is D over here, that is start diuretics and admit to ward for observation. You just observe the hemodynamic status of the child and what happens, some of the VSDs do not need any intervention, correct? The small VSDs, they'll close by itself. The large VSDs also, you just have to give medical management and that's it. So the correct answer is D over here, that is start diuretics and admit to the ward for observation. Is that clear? Okay, let's solve the next question. A 1-day-old baby is otherwise asymptomatic, presents with loud, harsh heart murmur on the left sternal edge. There is no evidence of heart failure. Now, this is a big hint for you all. No features of heart failure. The oxygen saturation is normal and ECG is also normal. Most likely diagnosis is ASD, large muscular VSD, pulmonary stenosis, and persistent arterial duct. So what do you feel is the answer? Okay, I've started getting. So one concept which I would like to clear over here is, okay, let me get more answers, then I understand what majority of you all are thinking. So most of you are giving up the answer as PDA. Okay, persistent ductus arteriosus or persistent arterial duct. But please remember one thing. It's a 1 day baby. The mnemonic is like, अगर right to left shunt है तो you know those are the T's. ठीक है, all cyanotic heart disease के जो T's है they are all right to left shunt, and left to right shunt है VSD, ASD and PDA. करेक्ट. ये राइट वाले जो रहते हैं ना, राइट टू लेफ्ट शंट, दे प्रेजेंट राइट नाउ. सो at the time of birth, right away they will present with a murmur, they will present with cyanosis like that. Whereas ये left to right shunt का late बन जाता है, they will present late. ठीक है, L left, L for later, late. So mostly this has to be some form of a cyanotic heart disease, because one में वो वन डे वन में ही उसको लार्ज मरमर चालू हो गया है. ठीक है, ऑन द लेफ्ट स्टर्नल बॉर्डर. नाउ द बिगेस्ट थिंग इज देयर इज नो फीचर्स ऑफ हार्ट फेलियर ऑल्सो. मरमर भी है, हार्ट फेलियर भी नहीं है, saturation is also more is normal, ECG will not show anything, there is a right heart predominance in a newborn. Correct. So most likely diagnosis over here is pulmonary stenosis. Yes, I finally got one correct answer. I think Dr. Rakesh, you picked up the hint what I'm trying to say. So pulmonary stenosis is the correct answer, which can very well present on day 1 of life. Quite unlikely for a VSD, PDA and ASD to present on day 1 of life. Just remember this. This trick will help you solve such kind of questions. ठीक है, ये जो ट्रिक है, like the left to right shunts always present later, right to left shunt will present right now. Okay, so this is a very good trick that will always help you. Okay, so the answer is C, that is pulmonary stenosis. A 15-month-old child is seen in clinic with a 3-month-old history of collapsing. ठीक है, the episodes occur when he has been hurt. He suddenly looks very pale, loses consciousness and falls to the floor. He then appears to stiffen and has some clonic movements of the arms and legs before quickly recovering. Examination is unremarkable. Which of the following is the most likely diagnosis? Now here, just keep in mind it's a 15-month-old baby, okay, and the episodes are the trigger for the episode is an injury or whenever he's getting hurt, right? Following that, he's becoming pale, he's losing his consciousness and then falls to the floor, correct? This is the second set of symptoms, and the third set of symptom is there is like a clonic movements. So this, what do you feel is the answer over here? Anybody wants to attempt this answer? Very good. Yes, I've started getting correct answers over here. What about others? Very good. So most of you are giving correct answer. The answer is reflex anoxic seizure. So it's not even a exactly breath holding spell, but it is something between a breath holding spell and a proper seizure. So they actually present like a breath holding spell. Falling an injury or hurt, they will become pale and suddenly they will lose consciousness and fall to the floor. Whereas the seizures are never a voluntary procedure. ठीक है, so the answer, even by exclusion you could have derived A answer, but most of you are correct in this. ठीक है, see, epilepsy, I got C answer. Some of you have marked C also. It's not a seizure. Why would a seizure be triggered following an injury? Seizures can never be voluntary. Okay, I hope that clarifies. So these clinical based questions are extremely tricky. You need to pick up the correct points which will lead you to the correct answer. The answer is A, that is reflex anoxic seizures. Please don't get confused. Okay. Now solve this. A preterm neonate who weighs 2.5 kg and is 3 days old requires a higher doses of benzene penicillin on milligram per kg basis than an adult to achieve the same plasma concentration. Which of the following is best describes why this should be? Okay, now options are. Now listen very carefully. Huh? This question is very important, very good quality question, and especially now you all are in touch with pharmacology also. So I hope that this question is easy for you. Option A is benzene penicillin. It crosses the blood-brain barrier in neonates more readily. B is neonates have a higher volume of distribution for water-soluble drugs. C is benzene penicillin is water-soluble and distributes to kidney at a faster rate in neonates. And D, it is excreted more slowly from the kidneys in neonates. So anybody who wants to attempt answering this question? See, I have taken all quality of questions from AIIMS point of view. So these are like difficulty levels, extremely difficult questions, moderately difficult, and non-difficult questions. So these are all mixed pictures. Yes. So Priyanka, you have given the correct answer. Very good. So neonates have a higher volume of distribution. Yes, yes, absolutely. All of you are answering it correctly. They have a higher volume of distribution for water-soluble drugs. Absolutely good because of the more extracellular fluid present in the neonate. Okay, very good. So all of you are correct. So good pharmacology knowledge. Excellent. Now solve this another pharmacology based question in pediatrics. The therapeutic plasma range of phenytoin is lower in neonates than in children. What is the likely diagnosis? Less phenytoin is needed to treat seizures on milligram per kg basis. Bilirubin displaces phenytoin from albumin more readily in neonates. Decreased albumin levels lead to increased phenytoin, and the phenytoin is more toxic in neonates. So, can you tell me what the answer could be over here? Okay, so you have a query that B could be the answer over here, but basically there is no such thing as bilirubin displaces phenytoin from albumin. Basically, the answer here is C. It is the decreased albumin levels in the newborns or the neonates that leads to increased free phenytoin. Okay, so that holds correct. That's why we need lower doses of phenytoin in newborns. So C is the correct answer over here. Okay, in fact literature doesn't say anything related to bilirubin displacing phenytoin. Most of you got confused between B and C. Such tricky statements can often be made, so not necessary that all the statements are correct also. Okay. So that was a good question. So answer is C. So congratulations, all of you have got their answers correct. Now solve this. Another question, pharmacology based question in pediatrics. Chloramphenicol may cause gray baby syndrome in neonates. What is the most likely reason for this? Chloramphenicol is able to cross the blood-brain barrier. Neonatal livers are unable to glucuronide high doses of chloramphenicol. Chloramphenicol is glucuronidated to a toxic metabolite in neonates, and gray baby is idiosyncratic reaction of chloramphenicol in neonates. So start answering this. Very interesting. ये तीनों questions are very important. In fact, very high yielding question. So did I get C as the answer for this? No, actually C is not the answer. You are absolutely correct, Dr. Rajesh and Dr. Priyanka. You have given correct answer. The answer is B. That is the neonatal liver, which is actually a very immature liver. It is not able to glucuronide high doses of chloramphenicol. So there is accumulation of chloramphenicol, which itself causes that gray baby syndrome. Okay, it's not a metabolite of chloramphenicol, or the chloramphenicol is not at all processed at all in the neonat's body. Okay, it just remains as it is, which gives the picture of a gray baby syndrome. Clear? So the answer is B. So congratulations, all of you have given correct answer. Very good, Pooja. You have also given correct answer. Take care. Wow. So now let's come to less difficult quality of questions. uh, a 3-year-old boy with normal developmental milestones with delayed speech and difficulty in communication and concentration. He's not making friends. Most probable diagnosis is, lovely question, A. Autism, B. ADHD, C. Mental retardation, and D. Specific learning disability. Yes. In fact, this was asked in AIIMS recently also. So this is actually a recent question. Very good. Math for AIIMS has happily given A as the answer. And all of you are correct. Absolutely correct. So the biggest hint over here is delayed speech. That is the typical hint. Rest other conditions will not have, apart from mental retardation, ADHD and specific learning disability will not have any delayed speech. Mental retardation, they have clearly given that there is normal developmental milestones, right? So the mental retardation is absolutely out of question. So the answer is A. Congratulations, all of you. You've given correct answer. Now, another AIIMS question recently asked: all are characteristic of Rett syndrome except increased incidence of mental retardation, seizure, abnormal dendritic morphology in cortical pyramid, and macrocephaly. Yes. The first thing that clicks the mind is, even if you don't know complete Rett syndrome, it is absolutely fine. The first thing that clicks your mind, देखते से ही strike होना चाहिए. Absolutely correct. All of you are correct, coming with the correct answer. The answer is macrocephaly. In fact, Rett syndrome doesn't have macrocephaly. It is the cause of acquired microcephaly. Correct? So till 1 year of age, the development is normal. The head circumference will be normal, but after that particular 1 year of age, they will start regression of the milestones. So there will be increased incidence of mental retardation. There can be seizures as well. There are abnormal dendritic morphology in the cortical pyramid, and then after 1 year of age, they start developing microcephaly. Their head stops growing, so they develop acquired microcephaly. Got it, all of you? So all of you are correct. Very good. Okay. Now, a 6-year-old child comes with complaints of bedwetting. The child is continent during the day and problem is only at night. Growth and development of child is normal. Urine microscopy is normal and specific gravity was 1.02, which is also normal. How will you manage? Reassure the parents and follow up at 6 months. Refer to psychiatrist, complete blood counts and USG KUB. Interesting question, borderline question, but the answer is very standard. So, what do you feel is the answer? Yes, I'm waiting. Very good. Yes. Okay. Majority of you have given correct answer. That is, reassure the parents and follow up in 6 months. This is nocturnal enuresis, and the best part about nocturnal enuresis is, 6 years is a borderline age, and literature has said, and even our clinical experience says, that after 6 years of age, mostly they spontaneously this enuresis regresses. Okay. If suppose it has not regressed after 6 months, then we go for the reinforcement therapy or the behavioral therapy, right? So I will not go into the details of explanation, because then that will occupy all the time, and we won't be able to complete our MCQs, which is our main target. That is to give you complete revision and maximum number of MCQs to be discussed within 25 minutes. Okay. So the answer is A. So most of you all are correct. That is reassure the parents and follow up after 6 months. Okay. Now coming to the next question. Order of development of secondary sexual characteristic in male is so testicular development, pubic hair, axillary hair, beard. Pubic hair, testicular development, axillary hair, beard. Testicular development, beard, pubic hair, axillary hair, and axillary hair, beard, pubic hair, testicular development. Yes, anybody? So I can see somebody flashing A. Yes, absolutely perfect. So you have given A as the answer, which is absolutely correct. Testicular development, pubic hair, axillary hair, and beard. So guys, please, whatever charts are there, whatever tables are present, are given to you from growth and development chapter. Just make it very thorough, especially the SMR charting, all these things because SMR पे question आ सकता है, ठीक है? So A is the answer. So all of you are correct. Very good. Best indicator for nutritional status for child is mid-arm circumference, head circumference, rate of increase of height and weight, and chest circumference. Yes. Now these are like the easy variants of questions for AIMS. So these are all AIMS questions only. They have been asked in the recent 5 years. So I hope you should be like revising all these questions. But anyways, let's practice it right away. What is the best indicator? Yes, Priya, you are absolutely correct. Others, you want to answer? Okay, I always get this same confusion amongst the students. Even previously, when we were discussing about the AIMS MCQ, or we were discussing this question in the tab chapter of nutrition and plus platform, I saw that many students are confused between the option A and option C. See, now what they're saying is the best indicator. स्पोर्ट में आके आप लोग क्या करते हो आपको लगता है कि यस एमएससी एक एसएएम का एक पैरामीटर है सो यू जस्ट मार्क अप मिड आर्म सर्कमफेरेंस बट द फैक्ट इज वी ऑलवेज go for the height and weight. They are the most or the best indicators for a nutritional status. Obviously, how will you measure the height for age or weight for age or weight for height without monitoring the height for weight, height and weight, right? Mid-arm circumference is the second thing that you would look for. The first thing you would look for is the height and weight. So the answer is C. Okay, so most of you have marked it absolutely correct. But for those who couldn't get it correct, please don't get confused. It is C is the answer over here. That is rate of increase of height and weight. Is that clear, all of you? Isn't it interesting? So the practicing MCQ is like practicing sums. What we used to do till our 12th standard, है ना? So all of these are a criteria for severe acute malnutrition in a 6-month-old, except mid-arm, upper arm circumference, symmetrical edema, weight for height and height for age. Yes. Now I'm asking Sam. So Sam should be very easy because this is something जो final year में भी पढ़ते हैं, viva में भी they keep on asking in the viva. Yes. Okay. Again, I'm getting a mixed picture. So what is the see all are the criterias except height for age. Sam के तीनों measurements है ना. Mid-arm circumference less than 11.5, symmetrical edema, weight for height, right? Correct. And height for age is more for a chronic type of malnutrition. But for Sam, we have all these three parameters. Got it, all of you? So D is the answer. पंकज, यू आई थिंक यू हैव मिस्ड आउट दिस एक्सेप्ट. ओके, आप एक्सेप्ट भूल रहे हो, दैट्स व्हाई यू आर सेइंग वेट फॉर हाइट. बट एक्सेप्ट है यानी विच इज नॉट देयर और विच इज नॉट measured for SAM. Okay, now this is similar to SAM but a different question. How is undernutrition defined? Wait for height less than minus 2 SD. Wait for age less than minus 2 SD. Wait for height less than minus 2 SD. Wait for age less than minus 3 SD, and wait for height less than minus 3 SD. Okay, so the question here is undernutrition. I am not asking about SAM. ठीक है, SAM का क्या है? Wait for height less than minus 3 SD बराबर है, और SAM के नीचे क्या आता है? Undernutrition. Correct? Which is not severe but it is undernutrition. Undernutrition आता है minus 2 SD. ठीक है, so the answer here is B, that is wait for height. Yes, got it. Okay, now this is one more question on nutrition. I think you have to read nutrition in a little bit more better way. Okay, read all the age related parameters, age independent indices, and whatever parameters are given for, like the IIP guidelines, the Waterloo classification, what are they, what are the cutoff points, what is SAM, how will you manage SAM, what is undernutrition, what are the calorie requirements, how we titrate the calories. These are all given beautifully in this particular, even OP Ghai में भी बहुत अच्छे से दिया हुआ है. ठीक है, so you can itself concentrate. Okay, so in this question I'm getting 150 kilocalories as the answer, but the answer is severe PEM. ठीक है, now there are two types of, when we are talking about moderate PEM, the calories that we start is from 150 kilocalories, but when we are talking about severe PEM, the calories is always 200 kilocalories. Please mark it or write it down somewhere. Yes, Amal has given a correct answer. Very good. The answer is A, that is 200 kilocalories. Is that clear? Okay, now solve this. Craniotabs is seen in following except rickets, syphilis, osteogenesis imperfecta, thalassemia. That's correct, Priya. For moderate, we start with 150 kilocalories. Okay. Craniotabs is seen in which of the following except rickets, syphilis, osteogenesis imperfecta, and thalassemia? What is the answer? Very easy question. These are all one-liners. Yes. So, yes, most of you are correct. The answer is thalassemia. In fact, in thalassemia, we do not see craniotabs. Disease for craniotabs includes rickets, syphilis, and osteogenesis imperfecta. In thalassemia, we see hemolytic facies, often called as chipmunk facies. आगे ध्यान में, ठीक है? So I'm getting a mixed picture, but I think I'm very clear. Majority of you have given a correct answer, that is thalassemia. Now solve this. Rickety rosary seen in all except rickets, scurvy, chondrodystrophy, and syphilis. Again, a very straightforward question, very simple question. Rickety rosary, rachitic rosary, whatever you want to say, is seen in all except rickets, scurvy, chondrodystrophy, syphilis. Very good. Very good. So DDs for rachitic rosary or rickety rosary is rickets, scurvy, and chondrodystrophy. How will you differentiate between the rachitic rosary of rickets and scurvy? In scurvy, the angulations are more acute. बहुत sharp edges रहते हैं, ठीक है? As compared to rickets. I have shown the pictures in one of my lectures on nutrition, beautiful pictures, after which um, well, I'm not sure whether we can exchange the numbers, but you can always follow me on Unacademy platform because I don't have any clear instructions whether I can share my WhatsApp number or not. But the best way you can do is you can follow me on Unacademy so that you get updated about the my activities. Plus, you can give me direct messages through that platform. Meanwhile, I'll just confirm whether I can share my WhatsApp number or not. But actually, we that is somewhat privacy will be interrupted, right? So never mind. We can do it via Unacademy, so don't worry. If you have the app, then also you can approach me. You can always drop messages on my profile. Okay? Okay. So now this is a wonderful question related to neonatology. Last five questions on all are related to neonatology. As you all know that AIIMS ka neonatology is very important, so you have to prepare that topic very well. A 3 kg term baby delivered by caesarean section develops respiratory distress soon after birth. The liquor was meconium stained and breath rate distress soon after birth. The liquor was okay. So breathing rate is 90 per minute. Correct statement is okay. See, the thing about such questions, the clinical based question is you need to pick up the small points also. So the liquor was meconium stained. A 3 kg baby. C-section. Okay. Respiratory distress soon after birth. Okay. That goes in favor of B. Most of you will be tempted to mark as A, as most of you have already marked A as answer. But if this was not given in the question, the liquor was meconium stained, अगर ये नहीं दिया रहता question में, then you would have gone for TTNB. ठीक है? But when they have already given the liquor was meconium stain, this is clearly a picture of meconium aspiration syndrome. So if you see this way, this is a very straightforward and a simple question. But we always are at a stress during our exams. We are so much overconscious that we feel that itna easy question kaise kya dala, and we try to twist it and give the twisted answer. But apparently, this is a very straightforward question, the easiest question probably what AIIMS could give, right? So the answer is B. Meconium aspiration syndrome. Okay, now solve this. Chronic lung disease in an infancy is defined as need for supplemental oxygen at 36 weeks after conception, tachypnea more than 50 breaths per minute, presence of bilateral infiltrates on X-ray chest for 2 weeks, and reticular granular pattern on chest X-ray for 6 weeks. Okay, Sikandar, are you talking about this question or the previous question, the meconium question? So in meconium aspiration syndrome, you can definitely get a breathing rate very high. In fact, it can be so high that it might require ventricular assistance also. Okay? So don't get biased. TTNB can also have high rate and meconium aspiration syndrome can also have very high rates. Yes. So I'm getting correct answers. Kripa and Rakesh have given correct answer. That is A. Pooja, you are also correct. The definition is very clear cut. There is no second thought in that. The answer is A. That is chronic lung disease, which is also called as, what is the other name for chronic lung disease? Bronchopulmonary dysplasia. ठीक है? So the answer is A. That is need for supplemental oxygen at 36 weeks after conception. Correct. In fact, bronchopulmonary dysplasia में the X-ray findings will not be clinically correlating to to the extent of the symptoms. Correct. So C is definitely not the answer. As for some of you might mark D also, but reticular granular pattern always favors HMD. ठीक है. So reticular granular pattern अगर आपको पूछा जाता है तो that is extensively HMD. It is more like when there is a, now if you remember that Silverman scoring, the need for supplemental oxygen at 36 weeks after conception is the cutoff point for bronchopulmonary dysplasia. ठीक है. So A is the answer. Okay. Now solve this. Hyaline membrane disease of lung is characterized by. Very simple question. Now what happens? You can remember it this way, that hyaline membrane disease mane surfactant is not there and there is an eventual solidification of the lungs. In fact, HMD ka newborn neonate, if you touch that the chest, it is like very hard to touch. Okay, so what happens? The functional residual capacity is decreased, is significantly decreased in hyaline membrane disease. So if you see the options, the 4 options in this, तो ये आ जाता है that FRC is smaller than the closing volume. तो एक ही option है जिसमें they are showing that FRC is smaller. So obviously A becomes your answer. So I'm getting a correct answer over here. Most of you are correct. ठीक है, that A is the answer. Functional residual capacity is decreased. A 5-year-old is rushed to the casualty, reportedly electrocuted while playing in park. The child is apneic and is ventilated with bag and mask. Which of the following is the next step in management? A. Check the pulses, start chest compression, intubate, and check oxygen saturation. So what do you feel over here? Let me give you a hint. This is PALS guidelines. Okay. I have recently taken a lecture on Academy Plus on PALS. Okay, and plus we had 3 sessions on neonatology also. In and out, different types of questions in neonatology were discussed along with some theoretical discussion as well. So if you are taking the plus subscription, it will always be very beneficial. Yes, so I got A as the answer, which is absolutely correct. Some of you have marked B as chest compression. See, you are not wrong, completely wrong, but this is like best of 4 options. So best of 4 में क्या रहता है आपको जो सबसे पहला next, now question is very specific, what will be the next step of management? So बहुत specifically उन्होंने पूछा है. So how will you know that the patient has got brady or tachy या arrhythmia है? It is only when you check the pulses. So after giving 2 rescue breaths, so the rule says that 2 rescue breaths, then you check the pulse. ठीक है, जो आपको heart rate बताएगा, and then you decide whether it's a you need to give the chest compression or you need to give the cardioversion. ठीक है, so the answer is A, that check the pulses. Clear? Okay, now we are coming to the end of a session. Which of the following is not true about newborn assessment? A. Apgar at 7 minutes indicates neonatal mortality depression. Apgar at 1 minute indicator for neonatal resuscitation. Fetus can rapidly wash out CO2 from placenta, and anaerobic metabolism causes acidemia. Very clear-cut question. We are asking what is not true about newborn assessment. Okay. So, anything beyond first 2 minutes is not acceptable. So of course, this first option is strikingly wrong in this. So the answer is A. Yes, I'm already getting correct answer. Kripa, Krishna, all of you have given correct answer. So first, the golden minute, the 60 seconds, first 60 seconds are like golden seconds for neonatal resuscitation. So whatever it is, the assessment, interpretation, resuscitation, everything has to be initiated within this first 1 minute. So 7 minutes tak we are not supposed to wait. to assess whether the child is neonatally depressed or has got a high mortality. Okay, the coming to the C and D options, both of them are absolutely correct. They will rapidly wash out CO2 from the placenta, and the anaerobic metabolism causes acidemia. Okay, quite self-explanatory and a very simple question. The last question, just a top up question. These are 25 questions, but I just thought I'll top up one last question with you all guys. A neonate presented with jaundice on the first day of life. How will you manage? Simple. So we are all talking about what? First 24 hours of life. So this is nothing else but pathological jaundice. And what are the causes of pathological jaundice? Commonest is RH and ABO incompatibility. Correct? So first day में pathological jaundice है, the first line of management is phototherapy. Yes, Sindhu, most of you have given correct answer. The answer is phototherapy. It's not A or it's not B. I got A as answer by somebody, and somebody has answered D. Or was that for A? So A is definitely not the answer, because this is pathological jaundice, not at all a physiological jaundice. Okay. एक्सचेंज ट्रांसफ्यूजन के भी अपने इंडिकेशंस होते हैं, अलग इंडिकेशंस होते हैं. द bilirubin is rapidly increasing, it has gone beyond 20, there is a risk of connect errors, then you will always give exchange transfusion, or if the cord blood is more than 4.5 milligram per DL bilirubin, and hemoglobin is less than 11. All these are the indications for exchange transfusions. So definitely none of them are mentioned in this question. But it is very clear cut that C is the answer, that phototherapy has to be initiated. Okay. So those who have given C, perfect. Okay. So these are the plus features. Just a brief introduction for all of you, because most of you must be knowing. Some of you, like, I know by name. I will try coming up with videos. Okay. We are working on that, but we were like, first let's discuss some more AIIMS MCQs. So some introduction about the plus features. We take live classes. You don't have to travel anywhere. See, for sitting at home, you can access all the lectures. My next class I'm planning on Tuesday. This will be like same time. Okay, 2 o'clock. This will be like next 25 more MCQs. Those will be now image based questions and the clinical based questions. Okay, so we'll be having a good mixture of those questions, and then after that I'll be having 2 sessions on mnemonics. So those are extremely important sessions. Please don't miss out this session on mnemonic, because for my PG entrance, the mnemonics have helped a lot, because I believe that brain block ho jata hai exam ke time pe, and sometimes we just cannot think or remember. So in those at that moment, mnemonics helped, and believe me, I had a very good all India ranking. I was 42nd ranking. So but this mnemonics, they helped me a lot. Okay, you can have unlimited access on the plus course, plus you can have lots of practice tests after each sessions. You can always download the PDF format. There are separate batch courses which are planned for all of you all, and plus we are always available for your guidance. Okay, so these are very good features that you can enjoy in plus. Important topics, Krishna, please prepare neonatology very well in pediatrics. Then go for the growth and development, all the important charts. ठीक है, निमोनिक्स का मैं आपको बेसिक बता दूंगी in my upcoming next YouTube sessions. I'll be uploading that, plus I'm taking a plus session also on mnemonics, which is extremely important. So वो थोड़ा और details में रहेगा, because I'll be getting 1.5 hour for that. Okay. And if you liked my class, please give a thumbs up, and that will just encourage me to come up with more interactive sessions. Okay. And last but not the least, this is my code, okay, which you can use to avail a 10% discount. You can actually see the prices are very nominal, especially from those coaching centers. These prices are very less. Okay. And and plus you don't have to travel, you can sit. So at both our comfortable level, we can always have a good discussion. Okay. So all the best, guys. Please stay safe. Stay away from coronavirus. Don't invite them. Stay at home. Don't go out much. Especially avoid movies and pictures, and going out to the malls. That is what I would advise. Okay. And if you are seeing patients, please use the N95 mask and don't put your hands in mouth or in your nose whenever in between your patients. Avoid doing that. Okay, I've already started using N95 mask, plus I'm using one special mask while traveling as well. So please take that precaution. It's for all of you. Exams are coming nearby. So uh, thank you very much. Please don't forget to give a thumbs up. That means a lot for me. And do follow me up on Unacademy platform. Okay? Take care and all the best.